Welcome to the Empowerment Hour, where we're about to shatter some misconceptions and dive deep into one of the most powerful tools for human transformation available today. I'm your host, Joss Blake, and for the next hour, we're going on a journey that might just change how you think about mental health, personal growth, and the courage it takes to seek help. Ever wondered what do Olympic athletes, successful business leaders, and people living their most authentic lives have in common? They all understand that peak performance, whether in sports, relationships, or personal fulfillment, requires guidance, support, and sometimes a completely different perspective. Yet somehow, when it comes to our mental and emotional well-being, we've been conditioned to believe that struggling alone is noble, that seeking help is weakness. Today, we're flipping that script entirely. We're going to explore how therapy isn't just about crisis intervention. It's about optimization, growth, and unlocking potentials you might not even know you have. From the moment you feel that first flutter of, maybe I need to talk to someone, to the profound transformations that can reshape your entire life, we'll cover it all. For more such insightful bite-sized podcasts, download Scoob app, your AI-powered podcast studio which will leave you with answers to the mysteries of the mind and more. Download now from App Store or Play Store. So whether you're therapy curious, currently in sessions, or someone who thinks they've got it all figured out, buckle up. This conversation might be exactly what you didn't know you needed. Let's start with a fundamental truth that might surprise you. There's no universal manual for when to seek therapy. No checklist that says, tick these 5 boxes and call a therapist. But here's what I can tell you. The simplest and most honest answer is this. If you have concerns about your mental well-being, that's reason enough. Think about it this way. When your body sends you signals, a persistent headache, unusual fatigue, or that nagging pain in your shoulder, you don't typically wait until you're bedridden to see a doctor. So why do we treat our mental health differently? Why do we wait until we're drowning to learn how to swim? The reality is that when we're experiencing fluctuations in our mental health, our decision-making abilities become compromised. It's like trying to navigate a storm when your compass is spinning wildly. The very condition that would benefit from professional help makes it harder to seek that help. It's a cruel irony, but recognizing this pattern is the first step toward breaking it. Here's where many people get stuck. They convince themselves they don't deserve help. They look around and think, other people have it worse. My problems aren't severe enough. I should be able to handle this on my own. Sound familiar? This mindset is incredibly common, but it's also incredibly destructive. Imagine telling a friend they don't deserve medical attention for a broken leg because someone else has a broken spine. Absurd, right? Yet we do this to ourselves with mental health all the time. We minimize our struggles, postpone getting help, and watch manageable hills grow into overwhelming mountains. The truth is, therapy isn't just for crisis situations. It's not just for when you've hit rock bottom and can't find your way up. Some of the most successful therapy experiences happen when people are functioning well, but want to function even better. When they're good partners, but want to be great ones. When they're managing life, but want to thrive in it. I've witnessed people transform their lives through therapy, not because they were broken, but because they were brave enough to ask, what if there's more? What if I could understand myself better, communicate more effectively, or find deeper meaning in my daily experiences? The changes don't happen overnight. Real transformation requires commitment, patience, and dedication to your own growth. It's like physical fitness. You don't run 1 mile and expect to be marathon ready. But just like fitness, the investment in your mental and emotional well-being compounds over time, creating benefits that ripple through every area of your life. But what happens when professional help isn't accessible? This is a harsh reality for many people around the world. Cultural stigmas, financial barriers, geographic limitations, and resource scarcity create significant obstacles. If you're in this situation, don't lose hope. Community support becomes invaluable. The internet has democratized access to mental health information and created global conversations that help normalize the ups and downs of mental wellness. The narrative around mental health is evolving. We're learning that emotional fluctuations are as natural as physical health variations. Stories of resilience and recovery are being shared more openly, planting seeds of hope and showing us that we're not entirely at the mercy of our emotional states. We can learn, grow, and exert influence over our mental well-being, even when professional resources are limited. Now let's address the elephant in the room: the persistent myth that seeking therapy is a sign of weakness. This misconception has prevented countless people from accessing help that could literally change their lives. So let's set the record straight once and for all. Seeking therapy is not an admission of failure. It's not waving a white flag or announcing to the world that you can't handle your life. It's actually the opposite. It's a demonstration of self-awareness, courage, and commitment to personal growth. It takes remarkable strength to look at your life honestly and say, I want to do better. Think about this. Olympic athletes, who represent the pinnacle of human physical achievement, rely on coaches to maintain and improve their performance. These aren't people who can't handle their sport. They're people who understand that external perspective, expertise, and guidance are essential for reaching their highest potential. The same principle applies to mental and emotional well-being. Consider parents who might be anxious about their parenting abilities. Rather than waiting until family dynamics reach a crisis point, proactive parents work with therapists to better understand and meet their children's needs. Similarly, couples experiencing minor conflicts shouldn't wait until they're on the brink of divorce to seek help. Early intervention in relationships often prevents small issues from becoming insurmountable problems. What's particularly encouraging is seeing how various institutions and communities are beginning to embrace this perspective. The Church of Jesus Christ of Latter-day Saints, for example, has had leaders openly endorse professional counseling as a viable and valuable option for addressing emotional and relationship challenges. Elder Jeffrey R. Holland has acknowledged that individuals often need more help than they can provide for themselves, particularly when dealing with significant personal struggles. He's recommended seeking guidance through counseling, recognizing that professional support plays a crucial role in healing and growth. This kind of institutional endorsement helps break down stigma and gives people permission to seek the help they need. Elder Wilford W. Anderson has addressed the challenges of depression and anxiety specifically, advising people to seek competent professional help while maintaining their spiritual foundation. This integrated approach acknowledges that mental health and spiritual well-being can coexist and support each other. Perhaps most powerfully, Elder Richard G. Scott has compared emotional and psychological injuries to physical ones, using the example of a broken leg that no one would attempt to heal alone. This analogy perfectly captures why seeking professional help for mental health challenges isn't just wise, it's necessary. Despite these encouraging endorsements and the growing awareness around mental health, barriers still exist. If you've ever hesitated to pursue therapy, it's worth examining why. Is it pride? The belief that your problems are insurmountable? Time constraints, financial concerns, or difficulty finding a trustworthy counselor? Here's the thing about these barriers. They're real, but they're not insurmountable. Pride often masks fear, and fear usually diminishes when we have accurate information and clear next steps. Financial constraints can be addressed through sliding scale fees, community mental health centers, or employee assistance programs. Time concerns often resolve when we prioritize our mental health, the same way we'd prioritize any other important appointment. The key is recognizing that these barriers are challenges to overcome, not permanent roadblocks. Every barrier you identify is actually a problem-solving opportunity, and overcoming them is part of the growth process that therapy facilitates. Remember, seeking help isn't about admitting you're broken. It's about acknowledging you're human. And humans, by nature, are social creatures who grow through connection, support, and shared wisdom. Therapy is simply a formalized, professional version of what humans have always done, sought guidance from those with experience and insight. Now that we've established when and why to seek therapy, let's dive into one of the most fascinating aspects of the therapeutic process: how conversation itself becomes a tool for transformation. This is where we enter the realm of talk therapy, an approach that might seem deceptively simple but is actually incredibly sophisticated. As someone trained in the psychoanalytic tradition, I'm particularly drawn to what we call psychodynamic therapy, though I prefer the more accessible term talk therapy. Unlike approaches that rely heavily on quantitative measures or structured interventions, talk therapy offers interpretive strategies aimed at providing deeper understanding of your experiences and emotional landscape. What makes talk therapy unique are two fundamental strategies that illustrate its transformative power. The first is the concept of not taking words at face value. Instead of rushing to conclusions or accepting surface-level explanations, both therapist and client exercise patience with language, allowing words to lead them on a journey that often uncovers unexpected insights. This is radically different from how we typically communicate. In most conversations, we're focused on efficiency, getting our point across quickly and clearly. But in therapy, the wandering path often reveals more than the direct route. The therapist creates an environment where you feel comfortable expressing thoughts freely, almost like taking your mind for a walk without a predetermined destination. This exploratory approach stands in stark contrast to algorithmic thinking or structured questionnaires that demand specificity. Instead, talk therapy encourages dialogue without self-censorship. Sometimes the most profound insights emerge from the seemingly random thoughts, the tangential stories, or the ideas that feel unimportant enough to share without careful editing. The second strategy involves examining how past relationships continue to influence present feelings and behaviors. This is where the concept of transference becomes particularly powerful. In the therapeutic space, the therapist maintains a kind of neutrality, acting not as a typical conversational partner, but as a reflective surface. Here's where it gets interesting. This neutrality helps you identify when your responses are influenced by emotions from past relationships rather than current reality. You might find yourself feeling frustrated with your therapist for being too quiet, when actually, that frustration stems from feeling unheard in your family of origin. Or you might feel suspicious that your therapist is judging you, when that suspicion reflects past experiences of criticism rather than anything the therapist has actually done. These projections, this transference, aren't mistakes or problems to be eliminated. They're incredibly valuable information about patterns that likely repeat in other areas of your life, where they're much harder to identify and address. In therapy, these patterns become visible and workable. Through this process, you begin to become aware of the subtle, unconscious narratives you create that powerfully influence your actions and emotions. You start questioning habitual responses, like automatically assuming someone is angry with you, or consistently blaming others for traits that might actually reflect your own insecurities. The pace of talk therapy is deliberately slower than typical conversation. This isn't inefficiency. It's intentional cultivation of a specific kind of self-reflection. You learn to pay attention while allowing your thoughts to explore freely, examining the overlooked aspects of everyday experiences that usually pass by unnoticed. Over time, this process unpacks complexities within seemingly mundane interactions. A disagreement about household chores might reveal deeper issues about feeling valued or heard. A pattern of arriving late might connect to anxiety about performance or fear of disappointment. The goal isn't to overanalyze every moment of life, but to develop a capacity for deeper understanding when it's needed. This kind of introspection creates lasting impact that extends far beyond the therapy room. You develop skills for having more honest conversations with yourself and others. You become more curious about your own motivations and more compassionate about the complexity of human behavior, both your own and others. The ultimate aim is encouraging a new form of self-awareness where you can delve into the fine details of your inner life, discovering the often hidden layers of your actions and motivations. Through this deliberate, thoughtful pace, talk therapy cultivates insights that help you achieve better balance in understanding yourself and the world around you. While talk therapy offers profound insights through conversation and reflection, it's just one approach in a rich landscape of therapeutic interventions. Understanding the different ways we can approach mental health challenges, particularly anxiety, gives us a comprehensive view of how healing actually happens. Let me take you through four major domains that shape how we understand and treat anxiety, each offering unique insights and interventions that can be incredibly effective depending on your specific needs and preferences. The psychoanalytic approach, while originating from Freudian concepts that are now largely questioned in many scientific circles, continues to inform modern therapeutic practices. This perspective suggests that anxiety arises from the repression of taboo ideas or inner psychic conflicts, often of a sexual nature, that create distress when pushed out of conscious awareness. Treatment involves psychodynamic psychotherapy, aimed at bringing these unconscious conflicts into consciousness, ultimately achieving personal insight and resolution. While this might sound outdated, many people find tremendous value in exploring the deeper psychological roots of their anxiety. The behavioral and cognitive behavioral domain offers a very different lens, tracing its roots to psychologists like John Watson. These theories assert that anxiety is essentially a learned, conditioned fear response. People develop anxiety disorders through unconscious conditioning, leading them to fear harmless objects or to fear things with minor threat potential with disproportionate intensity. Treatment here involves exposure therapy, where you gradually expose yourself to feared stimuli to reduce your fear response, combined with cognitive restructuring, which aims to change how you think about and respond to anxiety triggers. Contemporary research increasingly supports cognitive behavioral therapy as one of the safest and most effective interventions for various anxiety and depression conditions. The beauty of CBT is its practical, skills-based approach that gives you concrete tools for managing anxiety symptoms. The biomedical perspective has expanded considerably over the past 60 years, focusing on the biological underpinnings of anxiety. This includes brain structures like the amygdala, hippocampus, locus coeruleus, anterior cingulate, and insula, along with neurotransmitters such as serotonin, norepinephrine, dopamine, glutamate, GABA, and neuropeptide Y. Genetic factors also play a role in influencing these biological aspects. Treatments often involve pharmaceutical interventions designed to manage anxiety symptoms by targeting these biological pathways. Finally, the experiential approach takes an existential angle, viewing panic attacks and obsessional worrying as coping strategies invoked by the psyche in response to perceived threats to its integrity or self-esteem. This perspective values understanding the content and personal meaning of anxiety over focusing strictly on its biological mechanisms. Treatment often incorporates guided relaxation techniques and encourages exploration of underlying existential anxieties, including hidden traumas or feelings about one's existence. Now, here's what's fascinating. While these approaches might seem to conflict with each other, they're not mutually exclusive. In fact, innovative treatments are increasingly borrowing from multiple models to enhance effectiveness. For instance, cognitive behavioral therapy techniques are now incorporating elements from the biomedical model. Studies have shown that a medication called D-cycloserine can strengthen memory consolidation in the hippocampus and amygdala, enhancing the effect of exposure therapy by reinforcing new, non-fearful associations over previous fear responses. Simultaneously, the biomedical perspective increasingly acknowledges the efficacy of practices like meditation and traditional talk therapy in creating concrete changes in brain physiology, similar to transformations achieved through medications. A 2011 study by Massachusetts General Hospital researchers found that subjects who meditated for an average of 27 minutes daily over 8 weeks showed visible alterations in brain structure, specifically reduced amygdala density that correlated with decreased self-reported stress levels. Buddhist monks skilled in meditation display significantly higher activity levels in their frontal cortices and lower activity in their amygdalae compared to the general population. This suggests that meditation and deep breathing techniques affect the body just as psychiatric medications do, impacting not just abstract mental constructs, but our physical, tangible experiences of emotion. Recent research indicates that even traditional talk therapy can induce measurable physical changes in brain structure. This raises the intriguing possibility that psychological and biological interventions might be different paths to the same destination, a regulated, resilient nervous system capable of responding appropriately to life's challenges. What this means for you is that effective anxiety treatment isn't about finding the right approach. It's about finding the right combination of approaches for your unique situation, preferences, and goals. Some people thrive with the practical tools of CBT. Others find deep healing through exploring unconscious patterns, and still others benefit most from addressing biological factors through medication or lifestyle changes. The future of anxiety treatment lies not in these approaches competing with each other, but in integrating their insights to create more comprehensive, personalized interventions that address the full spectrum of human experience. Moving from treating specific symptoms like anxiety, let's explore one of the most powerful therapeutic approaches for creating lasting life satisfaction: acceptance and commitment therapy, or ACT. This approach shifts our focus from trying to eliminate discomfort to building a life aligned with what truly matters to us. Understanding your values is crucial for fostering motivation and providing clarity on your life's direction. Often, your emotional discomforts, your pain and complaints can actually serve as indicators of your core values. When something bothers you deeply, it's usually because it conflicts with something you care about profoundly. Recognizing this connection can lead to greater acceptance of difficult emotions and clearer direction for action. ACT emphasizes developing psychological flexibility, which involves staying present and aware of your feelings and physical sensations, including those that are challenging or uncomfortable. This flexibility encourages you to observe your emotions without judgment, moving away from decisions driven primarily by the desire to avoid discomfort or pain. Think about it. How many life choices are made from the motivation to avoid feeling bad rather than to move toward what matters? We might avoid difficult conversations to prevent anxiety, choose jobs that feel safe rather than meaningful, or stay in relationships that are comfortable but not fulfilling. While this avoidance strategy can work in the short term, it often takes us further from the life we actually want to live. Chasing constant happiness can lead to avoidance behavior, especially when negative thoughts threaten our sense of well-being. ACT suggests that rather than solely seeking pleasure, it's more effective to focus on actions that bring you closer to your core values, even when those actions involve temporary discomfort. To embark on a values-driven life, the first step is identifying what those values actually are. Values are dynamic and can evolve over time, offering you the freedom to adapt your commitments as you grow and change. They're not rigid rules demanding strict adherence. They act as guiding principles that facilitate decision-making and enhance life satisfaction. Consider examining your values across 4 key life domains: work and education, relationships, personal growth and health, and leisure time. Within each domain, ask yourself, what matters to me? What am I genuinely passionate about? What aspirations do I have? Which values have been imparted by my culture or family? And are they still significant to me today as an individual? Remember, a value isn't about achieving a specific goal, but rather about how you aspire to live your life. For instance, if your aim is to spend 1 evening per week with your spouse, the underlying value might be being an attentive and engaged partner, and you express this value through shared quality time. The evening together is just one way to honor that deeper value. If you're struggling to define your values, consider the goals or behaviors you wish to pursue and identify the values driving them. Online value lists can also be excellent tools for stimulating thoughts about your personal values, helping you articulate what might feel abstract or hard to put into words. Once you've identified your values, it's important to cross-check your current life against your stated values. For example, if you claim to value family time but are spending 80 hours a week at work, you might need to find innovative ways to honor that value within your current circumstances, or honestly reassess whether family closeness genuinely outweighs your work commitments. This isn't about judgment, it's about clarity. Sometimes we discover that what we think we should value isn't actually what we do value, and that's valuable information too. Other times, we realize we're living in a way that conflicts with our authentic priorities, and that awareness becomes the first step toward meaningful change. Make it a habit to regularly reassess your values and how they align with your life. As you age and circumstances change, your values might shift, necessitating adjustments along the way. This isn't inconsistency, it's growth and adaptation. Living in alignment with your values tends to bring about a greater sense of fulfillment and coherence in your life. It won't always feel pleasant. Values-driven living often requires us to do difficult things, have challenging conversations, or persist through uncomfortable periods. But you'll have the assurance that you're living in accordance with who you aspire to be. The goal isn't to eliminate all psychological discomfort, but to develop the flexibility to experience that discomfort without letting it dictate your choices. When you can stay present with difficult emotions while still moving toward what matters to you, you've developed true psychological flexibility, the ability to adapt your behavior to your circumstances while staying true to your deeper values and long-term goals. This kind of flexibility becomes a foundation for resilience, allowing you to navigate life's inevitable challenges while maintaining a sense of purpose and direction that transcends temporary emotional states. If you're passionate about building resilience and crafting a life guided by purpose, even when emotions run high, Scoob is your companion on the journey. Dive into podcasts that illuminate the art of mental flexibility, emotional intelligence, and personal growth, all curated by Scoob's AI-powered platform. Download Scoob from the App Store or Play Store and discover a world of insights designed to help you thrive, adapt, and make the most of every chapter in your story. Now that we've explored various therapeutic approaches and philosophies, let's get practical. How do you actually maximize the benefit from therapy sessions? Whether you're just starting therapy or you've been going for a while, there are specific strategies that can significantly enhance your therapeutic experience. Finding a competent therapist is crucial, especially when dealing with specific conditions. Look for someone who has undergone professional training and possesses substantial experience treating your particular concerns. It's also beneficial if they stay informed about the latest advancements in their field. Once you've identified a quality therapist, there are concrete steps you can take to make the most of your investment. Preparation is essential for successful treatment. One effective strategy is creating a concise timeline and history of your concerns. This might involve drawing a diagram that marks when problems began and how they evolved over time, especially during major life events like marriage, job changes, moves, or losses. Additionally, summarizing how these issues have impacted your daily life provides valuable context that helps your therapist understand your experience more completely. Once therapy begins, consider asking if you can record sessions. This allows you to revisit conversations and reinforces what you learned. Many people find that they remember only fragments of important sessions, and having a recording means you can catch insights you might have missed the first time. If recording isn't possible, maintain a notebook where you write down 5 to 10 key takeaways from each session. At the back of this notebook, keep a running list of questions or topics you want to discuss in upcoming meetings. Often, important thoughts or concerns arise between sessions, and having a designated place to capture them ensures you won't forget to bring them up. Writing notes, whether for personal use or to share with your therapist, can greatly enhance the therapeutic experience. Request reading materials if they're available. Many therapists can recommend books, articles, or other resources that supplement your understanding and progress. This homework approach helps extend the therapy process beyond your scheduled sessions and can accelerate your growth. Punctuality and consistent attendance are fundamental, but often overlooked factors in therapeutic success. Regular, reliable attendance creates momentum and allows you to build on insights from previous sessions. Sporadic attendance makes it difficult to develop the trust and continuity necessary for deeper work. Recognize topics that may be challenging for you to discuss and consider why they're difficult. Is it embarrassment? Fear of making thoughts feel more real by speaking them aloud? Concerns about being judged by your therapist? Understanding your resistance can actually become valuable therapeutic material. It's beneficial not to keep significant secrets from your therapist. Many psychological problems thrive in secrecy and shame. Consider making a list of topics you're hesitant to discuss, noting the reasons for this difficulty if you're aware of them. This exercise itself can be revealing and help you understand what you're avoiding and why. Setting shared goals early in therapy is another critical aspect. Your therapist should outline therapy objectives and ensure they align with your long-term personal goals. These might include professional aspirations, relationship improvements, or lifestyle changes. Sometimes achieving broader life goals requires overcoming specific challenges first, like feeling comfortable leaving the house to attend a training course if you're dealing with anxiety. Understand that guided discovery will be a central part of your therapy experience. Your therapist will ask numerous questions to better understand your daily life and the nature of your concerns. This questioning serves to merge your personal understanding of your issues with the therapist's professional expertise. As therapy progresses, the questions become designed to help you incorporate new insights into your thought processes, facilitating the changes needed to address your concerns. Remember that while your therapist may be an expert in psychology and treatment approaches, you are the expert on your own experience. Therapy is a collaborative effort between two kinds of expertise: their knowledge of therapeutic processes and your knowledge of your inner world. The most effective therapy happens when both types of expertise are valued and utilized. Be patient with the process. Meaningful change takes time, and therapy often involves periods of feeling worse before feeling better as you examine difficult material or challenge long-standing patterns. Trust the process while also advocating for yourself if something doesn't feel right. Finally, be honest about what's working and what isn't. Good therapists want feedback and will adjust their approach based on your needs. Therapy should feel challenging but supportive, difficult but hopeful. If it consistently feels harmful or unhelpful, it's worth discussing with your therapist or considering whether you need a different therapeutic approach or provider. Let's talk about something that might surprise you: the therapeutic value of complaining. Yes, you heard that right. That thing we're often told to stop doing, that behavior we judge in ourselves and others, might actually serve an important psychological function. Human beings have an innate tendency to complain. This is backed by both casual observation and professional experience. As therapists, we frequently encounter individuals who seek services primarily to have a space where they can freely express their frustrations and grievances. On the surface, this might seem unproductive, but there's often more happening beneath the complaint than meets the eye. Consider Sam, a client who regularly comes to therapy to articulate concerns about various aspects of his life. He discusses frustrations with his business partner, expresses concerns about his marriage, reflects on financial dilemmas, and talks about challenges with his children. While these sessions tend to have a negative undertone, Sam also exhibits significant gratitude, self-awareness, and accountability when necessary. For Sam, these sessions appear to be cathartic experiences. He finds solace in sharing his thoughts and seeks validation during interactions. However, this raises an important question. Is habitual complaining overshadowing therapeutic intent? Are sessions being consumed by venting instead of targeting specific, goal-oriented changes? This tension illustrates a fundamental challenge in therapy. There's often a voice that urges therapists to step in and redirect conversation toward solution-focused work. The impulse is to encourage change, to provide guidance, to move from problem identification to problem resolution. Sometimes therapists succumb to this impulse and interrupt the venting process. But here's what often happens when therapists interrupt the venting process prematurely. Clients react with surprise and discomfort. They look puzzled, perhaps even irritated, as if they've been halted mid-thought. This reaction suggests that at that moment, they most need someone to simply listen. They aren't ready for advice, nor have they requested any. These experiences teach us something important about the venting process. While it might seem unproductive from the outside, it often serves crucial psychological functions. Venting can provide emotional release, help people process experiences, and offer a sense of being heard and understood. For many people, having their frustrations witnessed and validated is itself therapeutic. We all experience moments similar to Sam's. Whether it's about unfinished road construction, challenging workplace dynamics, or frustrating interactions during our commute, complaints are ubiquitous in human experience. We even find ourselves complaining about people who never stop complaining. The irony isn't lost on us. Yet it's important to acknowledge that, while complaints could often be more constructive, they serve an enduring purpose in human interaction. They offer a form of emotional release and connection that has been part of human experience across cultures and throughout history. The key insight here is understanding when venting serves a therapeutic purpose versus when it becomes stuck or circular. Productive venting typically includes some element of self-reflection, accountability, or movement toward understanding. It might involve recognizing patterns, acknowledging personal responsibility, or expressing gratitude alongside the frustrations. Unproductive venting, on the other hand, tends to be repetitive, blame-focused, and resistant to any shift in perspective. It becomes a way of avoiding responsibility or change, rather than processing emotions toward greater clarity. As listeners, whether we're therapists, friends, or family members, learning to distinguish between these types of venting can help us respond more appropriately. Sometimes the most therapeutic response is simply bearing witness to someone's frustration. Other times, gentle questions or observations might help move the venting toward greater insight. For those doing the venting, developing awareness of your own process can be valuable. Ask yourself, am I sharing this to process and move through it, or am I sharing it to stay stuck in it? Am I looking for validation, advice, or simply a sympathetic ear? Being clear about what you need can help you communicate more effectively and get better support. The therapeutic value of venting lies not in eliminating it, but in understanding its function and using it consciously as a tool for emotional processing and connection. Sometimes, we need to voice our frustrations before we can see them clearly enough to address them constructively. While individual therapy offers profound benefits, there's something uniquely powerful about healing in community. At the heart of human nature lies an inherent social inclination. We're driven by fundamental needs for companionship, belonging, affection, and nurturing within community settings. Given this intrinsic social nature, addressing mental health challenges is often most effectively achieved through engagement in intimate group settings. The origins of group therapy trace back to an unexpected meeting in 1935 between Bill Wilson, a New York stockbroker, and Dr. Bob Smith, a surgeon in Akron, Ohio. Bill was on the path of recovery from alcoholism, while Dr. Bob was struggling as an active alcoholic. At that time, many people, including Bob, perceived alcoholism as a moral failure. Bill presented a revolutionary perspective. Alcoholism is a mental and physical illness rather than a moral decline, and it can be treated. This insight was pivotal for Dr. Smith's recovery and led to the establishment of Alcoholics Anonymous, which became the pioneering self-help group. The foundation of AA was built on the premise that healing from alcoholism is best facilitated when recovering and active alcoholics unite in intimate group settings, sharing personal struggles and stories to cultivate a supportive community. Although AA later developed into a structured 12-step program, the essence of its success lies in empathetic interactions and mutual support among people with shared experiences. The remarkable outcomes achieved by AA quickly spread its influence, and by 1955, the movement had grown to include over 2 million members. AA effectively bridged theoretical divides in psychology by integrating both relational and emotional components alongside behavioral conditioning elements. This integration demonstrated that healing could happen through connection and shared experience, not just through individual treatment relationships. Concurrent with AA's early development, psychologists were exploring group intervention techniques within formal psychotherapy. The impetus came from World War II, which resulted in overwhelming numbers of psychological casualties suffering from traumatic stress disorders that exceeded the capacity of individual treatment. Psychologists like Carl Rogers, John Rawlings, and William Sargent in the United States, and Eric Trist in Britain, began implementing group therapy approaches. Their work drew inspiration from earlier pioneers. Alfred Adler, one of Freud's prominent disciples, had employed group therapy with adults and children in his child guidance clinics. Meanwhile, Trigant Burrow, a founder of the American Psychoanalytic Association, experimented with group analysis by bringing together patients and their families. Unlike Freud, who viewed mental illness as predominantly an internal psychological issue, Burrow contended that mental illness is deeply intertwined with an individual's social interactions and relationships. He advocated for group therapeutic settings as essential for restoring mental health, recognizing that healing happens in relationship with others. One of the most innovative approaches in group therapy was psychodrama, pioneered by Jacob L. Moreno. As both a psychologist and sociologist, Moreno embraced the view that creativity is fundamental to human nature and essential to well-being. He believed creativity is not typically a solitary endeavor, but is fostered through social interactions. Moreno leveraged theatrical techniques like role-playing and improvisation to stimulate creativity and enhance social trust. One of his key tools was role reversal, where participants assume another person's identity to cultivate empathy and refine it to heightened levels of expression. Through these methods, psychodrama contributed significantly to understanding mental health treatment within group contexts. What makes group therapy particularly powerful is the recognition that many of our psychological struggles are fundamentally interpersonal. Issues with trust, communication, boundaries, and self-worth often show up most clearly in relationship with others. Group therapy provides a laboratory where these patterns can be observed, discussed, and practiced in real time. In group settings, you're not just talking about your relationships, you're actually relating. You might notice that you automatically defer to others, or that you become defensive when given feedback, or that you struggle to express needs directly. These observations become immediate material for therapeutic work. Group therapy also provides something individual therapy cannot: the validation that comes from realizing you're not alone in your struggles. Hearing others articulate experiences similar to your own can be profoundly normalizing and healing. The shame that often accompanies psychological distress begins to dissipate when you realize that your struggles are part of the human experience. Additionally, group members often serve as powerful agents of change for each other. Sometimes hearing feedback from a peer carries more weight than the same feedback from a therapist. Group members can challenge each other's perspectives, offer different viewpoints, and provide support in ways that feel authentic and non-professional. The beauty of group therapy lies in its recognition that healing happens in community, that our social nature isn't a complication to address, but a resource to utilize in the service of growth and recovery. As technology continues to reshape every aspect of our lives, it's no surprise that it's also transforming how we access and experience therapy. Online therapy, once viewed with skepticism, has become an increasingly important and validated option for mental health care, especially as our world becomes more connected and our schedules more demanding. Despite initial concerns about the effectiveness of technology-mediated therapy, research reveals fascinating insights about both the providers and recipients of online therapeutic services. Online therapists tend to be middle-aged, well-educated, proficient professionals, predominantly from North America, with preferences for cognitive behavioral methods and ample clinical experience. Interestingly, most online therapists acquire their digital therapeutic skills through informal channels like textbooks rather than formal training programs. This suggests that the transition to online work often happens organically as experienced therapists adapt their existing skills to new platforms. These practitioners generally express satisfaction with their online practice and believe it to be effective. When we look at the characteristics of online therapy clients, we find that the majority are female. Many initially assume these services will be free, and they typically seek short-term therapy for issues related to relationships, family dynamics, mood disorders, and anxiety. This profile suggests that online therapy is attracting people who might not otherwise seek traditional in-person treatment. However, the online environment presents unique challenges. The absence of nonverbal communication increases the likelihood of miscommunication, as so much of human communication happens through body language, facial expressions, and subtle vocal tones that may be lost or distorted through digital platforms. Time delays inherent in email-based therapy can also create challenges, potentially disrupting the natural flow of therapeutic conversation. Additionally, limitations in computer skills on either the therapist's or client's part can create barriers to effective communication. Perhaps most significantly, online platforms limit the ability to provide immediate intervention during crisis situations. If a client is experiencing suicidal ideation or other psychiatric emergencies, the physical distance can complicate rapid response and safety planning. Cultural considerations also become more complex in online settings, where subtle cultural cues might be missed, and identity verification can be challenging when therapist and client have never met in person. There are also legitimate concerns about the security of sensitive information transmitted over the internet. Despite these challenges, online therapy offers unique opportunities that can actually enhance the therapeutic experience for many people. The convenience and accessibility are obvious benefits. People can access therapy from their homes, eliminating transportation barriers and making it possible to fit sessions into busy schedules. For many clients, the online medium fosters a sense of safety and security that encourages greater openness and less inhibition. Some people find it easier to discuss sensitive topics when they're in their own familiar environment rather than in a clinical setting. Email-based therapy allows for reflective thinking and therapeutic writing that some individuals find particularly beneficial. The ability to craft thoughtful responses and revisit therapeutic correspondence can deepen the therapeutic process in ways that spoken conversation alone might not achieve. Many people report feeling a sense of closeness with others they meet online, a phenomenon known as telepresence. This suggests that meaningful therapeutic relationships can indeed develop through digital platforms even without in-person contact. Online therapy also provides immediate access to vast internet-based resources that can supplement therapeutic work, from educational articles to self-help tools to community support forums. The effectiveness research is compelling. A meta-analysis of 92 studies focused on internet-delivered therapy found it to have a moderate and enduring effect size of 0.53, with no significant differences between therapy conducted face-to-face and therapy delivered via web platforms. This evidence challenges earlier criticisms that questioned whether digital communication could provide the depth and nuance necessary for effective therapeutic work. While online therapy may seem less stimulus-rich than traditional face-to-face therapy due to the lack of nonverbal cues, research suggests it doesn't inherently result in lower-quality therapeutic interactions. The key insight here is that online therapy isn't necessarily better or worse than in-person therapy. It's different, with its own unique benefits and limitations. For some people and some issues, it may be the ideal format. For others, in-person work may be essential. And for many, a combination of both formats might provide the most comprehensive care. As we move forward, the integration of technology into mental health care will likely continue expanding, offering new possibilities for reaching underserved populations, providing innovative therapeutic tools, and making mental health support more accessible to people around the world. As we near the end of our exploration of therapy's benefits, it's crucial to address how mental health care can and must be inclusive of all people's experiences, particularly those who face unique challenges in accessing and receiving appropriate care. The transgender community provides an important lens through which to examine both the barriers and possibilities in mental health treatment. The experiences of transgender individuals with mental health services are influenced by complex factors including societal pressures, personal challenges, and the availability, or lack thereof, of appropriate support systems. Many transgender people seek mental health care for various reasons, some as part of their transition process, others to gain deeper self-understanding, and many to address common mental health challenges like depression, anxiety, or substance abuse that can significantly impact quality of life. These challenges are often exacerbated by unique stressors that transgender individuals face at higher rates than other populations. Family rejection, bullying, threats of violence, and physical or sexual abuse are unfortunately common experiences. Many transgender people spend extended periods grappling with discomfort in their bodies or societal roles, creating additional psychological stress. Historically, finding mental health providers who recognized transgender individuals as complete people rather than reducing their identity to a pathology was nearly impossible. The medical and psychological establishments often pathologize gender diversity, creating additional trauma for people seeking help. However, as awareness and understanding have grown, so has the availability of affirming, knowledgeable providers. Increasingly, transgender people are entering the mental health profession themselves, bringing lived experience to complement clinical training and further enhancing understanding and acceptance within the field. This represents a significant shift toward more inclusive and competent care. For anyone engaging with a therapist for the first time, but particularly for transgender individuals, the initial experience can feel intimidating. Providers typically ask numerous questions, some of which might not seem immediately relevant. They might offer a diagnosis, which can feel overwhelming due to the labeling it implies. For transgender people, past negative experiences with healthcare providers can create additional reluctance to be vulnerable. Confidentiality remains a cornerstone of mental health services and is generally addressed during initial sessions. This commitment to privacy is particularly important for transgender individuals who may face discrimination or safety concerns if their gender identity or transition status were disclosed without consent. However, confidentiality has limits, especially regarding safety concerns or when working with minors, so it's important to clarify these boundaries early. The diagnostic process in mental health often shapes initial meetings, involving thorough questioning to reach accurate understanding of a person's experiences and needs. While receiving a diagnosis can feel unsettling, it can also provide relief by offering a framework for understanding struggles and guiding treatment approaches. For transgender individuals, this process may include questions about their gender journey, when they realized their gender identity, how they've shared this with others, fears around disclosure, and any discrimination or stress connected to their gender identity. While some questions are standard, they can feel invasive, particularly when providers lack sufficient knowledge about transgender experiences. Unfortunately, some clinicians may ask inappropriate questions out of curiosity or misconceptions, sometimes viewing transgender identity itself as pathological rather than focusing on specific mental health concerns the individual is experiencing. It's important to remember that quality mental health care should address specific issues beyond gender identity, unless that identity is directly relevant to the presenting concerns. If a provider's approach feels targeting or inappropriate, leaving the session is always an option. Mental health care should be supportive and affirming, not adversarial or discriminatory. Finding providers who are knowledgeable about transgender experiences and committed to affirming care is crucial for effective treatment. The broader lesson here extends beyond transgender-specific concerns to all marginalized communities. Effective mental health care must be culturally responsive, trauma-informed, and respectful of diverse identities and experiences. This means providers need ongoing education about different communities, awareness of their own biases, and commitment to creating safe, inclusive therapeutic environments. For individuals from any marginalized community, advocating for appropriate care is both a right and sometimes a necessity. This might involve educating providers about your experiences, seeking referrals to more knowledgeable clinicians, or connecting with community resources that can provide additional support. The evolution of mental health care toward greater inclusivity benefits everyone, creating systems that are more responsive to human diversity and more effective at providing healing for all people seeking support. As we reach the end of our comprehensive exploration of therapy's benefits, let's take a moment to reflect on the journey we've traveled together. We've dismantled myths, explored diverse approaches, and discovered that therapy isn't just about fixing what's broken. It's about nurturing what's possible. We began by challenging the misconception that therapy is only for crisis situations or signs of weakness. Instead, we've learned that seeking therapeutic support demonstrates courage, self-awareness, and commitment to growth. Just as Olympic athletes rely on coaches to maintain peak performance, anyone can benefit from professional guidance in optimizing their mental and emotional well-being. We've explored how different therapeutic approaches, from psychodynamic talk therapy to cognitive behavioral interventions, from biomedical perspectives to experiential methods, offer various pathways to healing and growth. The beauty lies not in finding the right approach, but in discovering the combination of strategies that resonate with your unique needs, preferences, and goals. After venturing into the new avenues in AI and digital therapy, at last, our discussion of inclusive care highlighted the importance of finding providers who understand and affirm diverse identities and experiences, ensuring that therapy truly serves all people seeking support. Throughout this exploration, several key themes have emerged. Therapy is for everyone, not just those in crisis. It's a tool for optimization, growth, and living more intentionally. The courage to seek help demonstrates strength, not weakness. Different therapeutic approaches offer various pathways to healing. There's no one-size-fits-all solution. Real change takes time, patience, and commitment to the process. Community and connection are essential elements of mental health and healing. Technology has expanded access while maintaining therapeutic effectiveness. Inclusive, affirming care is crucial for effective treatment. Perhaps most importantly, we've learned that mental health exists on a spectrum, and taking care of our psychological well-being is as important as maintaining our physical health. Just as we wouldn't ignore a persistent physical pain, we shouldn't ignore persistent emotional distress. The landscape of mental health care continues evolving, becoming more accessible, inclusive, and effective. As our understanding of human psychology deepens and our tools for healing expand, the possibilities for growth and transformation continue to multiply. I'm Joss Beaklake, your host for today's episode on The Empowerment Hour. Thank you for joining me on this exploration of therapy's benefits. Remember, seeking support isn't just about surviving. It's about thriving. It's about becoming the fullest version of yourself and living a life aligned with your deepest values and aspirations. The conversation about mental health doesn't end here. It continues in your daily life, your relationships, and your ongoing commitment to growth and well-being. Whatever your next step in this journey, take it with confidence, knowing that support is available and that investing in your mental health is one of the most valuable investments you can make. And remember, if you're looking for more inspiration or simply a sense of connection on your journey, Scoob is here for you. With a plethora of podcasts dedicated to mental health, resilience, and personal growth, Scoob's AI-powered platform curates content to support you every step of the way. Download Scoob from the App Store or Play Store and keep exploring the possibilities for healing and growth, because your story is always unfolding and you deserve to thrive. Also, don't forget to like and subscribe to our channel, The Empowerment Hour, to stay updated with the latest podcasts on motivation, self-help, and the little boost you need along your journey. Until next time, be gentle with yourself, stay curious about your inner world, and remember that healing and growth are always possible.